Sure.
Well, welcome everybody. Thank you very much for coming. I'd just like to introduce myself. I'm Dr. Anthony Clark. I'm a retired Bridlington GP and I'm chair of the Bridlington Health Forum. We've got we're just going to adjust the amplification. I'll just repeat that then. Can you hear me now? No. I'll get a bit closer to the microphone. Is that any better? Okay. So my name's Dr. Anthony Clark. I'm chair of the Bridlington Health Forum. In a former life I was a Bridlington GP. So you're very welcome. I'm aware that we've also got a full overspill room at the back with 40 or 50 people, and there are people out in the corridor as well. So just to mention, there's a fire exit here. There are two fire exits from the corridor. The next important thing to mention is that we are live streaming to our Bridlington Health Forum Facebook page. The camera is just here at the front. It's possible that we might make a YouTube recording from the live stream at a later date. We had looked north here earlier. I just wanted to check, are there members of the press amongst us? I don't think there's any videoing going on or filming, but and Look North are coming back about 2:15, but I think they're hoping to interview a few people outside. So, I would particularly like to thank the Bridlington Health Forum members who've enabled all this to happen and facilitating things like the sound and everything like that. And everyone has a part to play, and that includes the more than 2,300 members of our Facebook group. In fact, it includes all the residents in Bridlington. We've all got a part to play to raise the profile of Bridlington Health Forum. And now I'd like to just introduce our special guests. One of our guests hasn't quite arrived, I think. But we have... Is there a microphone at the back? Okay. Can you turn the loudspeaker up? Is that any better now? Is that any better? Can you hear at the back? A little, okay. So I'd very much like to welcome Martin Barclay, who's chair of the York Trust.
Good afternoon.
Martin has been in post about 3 months.
Nearly, yes.
Nearly 3 months. So be kind to him. But we're also expecting Simon Cox, who's the director of the East Riding Integrated Care Partnership, and he's been in post about 18 months. And we're also very pleased to welcome back Dave Tucker, portfolio holder for adult health and social care from the East Riding Council in Beverley, so you're all very welcome. We also have Melanie Lively, who's one of the board members of York Trust with us, and she's been coming to Bridlington for our multi-agency meeting, so thank you very much for coming. So our goals for today, perhaps before I go on to the next slide, we're going to have a brief presentation from Bridlington Health Forum, then we're going to give you an opportunity to have your say, then we would like to give our guests an opportunity to respond to what they've heard, and I suggest when we come to that point you just turn your chairs around and come and sit here so that you can actually see everybody and respond accordingly. So I'll press on, and we've got 3 contributors from the Bridlington Health Forum. I'm going first. So, healthcare in our coastal community, as you can see, access is our main concern, and this is because we've got an older population. A third of us, including myself, are retired and over 65. We've got the highest levels of deprivation within the East Riding, and we've got the most number of long-term conditions. So we know that there's a kind of almost like tsunami of medical conditions building up that are going to go in the direction of the York Trust, and it's very important that we try and address that problem. So we have the longest period of unhealthy number of years lived here in Bridlington. Our life expectancy has worsened and excess deaths have increased. These kind of things were highlighted by Professor Sir Chris Whitty in 2021. We certainly feel everything that he described in his report into health on coastal communities here in Bridlington. We are isolated geographically, even though we're the largest town in East Riding, and we have that travel challenge to appointments outside of Bridlington, and many of our appointments are now at distant hospitals. So there's a picture of Sir Chris Whitty, and a reminder of our geographical isolation here in Bridlington. We're away from the big hospitals down in the Hull area. Beverley is much closer, and we do have a 20-mile trek to Scarborough, and of course a longer and more difficult trek to Malton Hospital. So we've got very many of us are over 65 now, and access is a real concern. In the North Ward, we have 44% of the population over the age of 65. So you can see we have got significant numbers. A lot of retirees like to come to Bridlington. And on the south side, we've got deprivation that affects young families. We've got a lot of single parents. I've already mentioned that we've got a number of areas of deprivation. In fact, 9 out of 13 of these Riding's areas of socio-economic deprivation are here in Bridlington. I have to say that I live on the south side, so it's actually a good place to live, but the media does like to highlight deprivation in Bridlington, and so we need to try and change the narrative about our town. We are popular with tourists and retirees, but of course all the people moving to Bridlington don't realise that access to medical services is a challenge, and many of them comment to me and others when they come from the West Riding how different it is here on the coast. I read this week in the British Medical Journal that Michael Marmot, Director of the Institute of Health Equity, has recently said that the UK is an object lesson in how not to tackle health inequalities. So we have got a lot to learn in this country about reducing health inequalities. Let's move on. Just very quickly for Martin's benefit, we do have local concerns about GP access, and it is particularly with one practice, and we're working with them to try and improve that situation. It is important because as a retired GP I am concerned about delays in diagnosis and poor uptake of screening, for example, when access is difficult. We also have significant delays within our mental health care service. We have high levels of mental illness here in Bridlington, and the waits for appointments are really unacceptably long, and because they're so long, they don't actually contribute a great deal to the health of the people with the mental health illnesses. And this is particularly a problem for our children and young people in Bridlington. Now moving on, just to give you the overall picture. Dentistry is dire in Bridlington. We've moved from having the big Oasis practice, which was run by Bupa, and then over a year ago now, it decided to just pack up and leave Bridlington because it couldn't attract enough NHS dentists. So we've gone from an oasis to a dental desert. And there are thousands of people without dentistry, hundreds of children not having regular checks. But we know that the commonest cause of hospital admission for children between the ages of 6 and 10 is tooth decay. We know that the greatest number of, the largest number of operations that children undergo are for dental reasons. So we're really storing up a lot of problems for the future. I'd just like to welcome Chris Mills from the ICB at the back there. If you'd like to come forward, you're welcome to. We are expecting. We're expecting Simon Cox at some point, I believe. So, and my final slide is to raise this question. We would like to see what can be safely done in Bridlington Hospital expanded, and there's a lot of potential there. We pick up from the community their concerns about the underuse of the hospital. We would like to see the hospital used up to its full capacity. We know that there may be a surgical procedures day unit in the pipeline. We'd like to see that actually come into being as quickly as possible. We'd like to see fewer residents being offered surgery in York and more along the coast here, so to have surgery expanded. We'd like to see expansion of services in the urgent treatment centre to reduce the need for people to go to Scarborough Hospital. And also our residents have the right to die closer to their homes here in Bridlington, and provision of inpatient palliative care beds would be extremely welcome. We feel that we are the largest town in East Riding, and we have lost our inpatient palliative care unit, and we believe that we can do better with serving our very ill, terminally ill population. I'm going to hand over now to my Vice Chair, Andy Levitt.
Hi. I first moved to Bridlington 45 years ago. At that point, there were a couple of hospitals operating, and there was a big, long wait for this new hospital to be completed and start operating. That happened, and it was operating really quite successfully. But along came a whole host of changes and reductions in budgets, and what happens? You get the sword of Damocles dangling over the hospital, threatening more and more cuts. That has a negative effect on recruitment, on patients' aspirations, on all aspects, and we don't want that. It's the largest footprint in Bridlington. It's purpose-built. It's obviously less than 45 years old, and in hospital terms, that's quite young. We then move on. There was a rare investment to make Bridlington Hospital the greenest hospital, possibly within the Trust, possibly within the north of England. Fantastic. £4.7 million invested. But I called it a bit of a green elephant to Simon Morritt, who is the CEO of North Yorkshire Trust, because it's fantastic having that facility, but if it's not used, what's the point? It is a tick box, but I don't like to say that. We then start to look at some of the imbalances that are happening. North Yorkshire, seem to have all the facilities. Bridlington, which is on the edge of the York and Scarborough Trust, seems to have had lots and lots of facilities taken away. Centralisation, I understand some aspects of centralisation, but not at the expense of local populations. We have rights, and people need to take notice of those rights so that we can feel satisfied and cared for. The investment. Oh, our chickens disappeared. Right? Follows a decade of managed decline. Quite a few years ago, I had a cardiac scare and spent time in Bridlington Hospital on the cardiac unit. Gone. Right? All sorts of other services have disappeared. I understand that if I do have a cardiac scare, I want the best possible treatment. But I don't want to die getting there. We've calculated that the patients here have travelled 1.7 million miles for appointments. Now, that's fine. It's half of the amount of green power saved by the investment. But it costs. It costs some people hundreds of pounds to get to appointments. Because often you don't have one, you have follow-up appointments. And not everybody's pockets are as big as other people's. And therefore, our poorest are being hit hardest. Our greenest site is starved of local services and resources, and sometimes patience. There was a report saying that the East Coast needed more opportunities for secondary health care. That report was 2008 strategy. But in 2012, only one of the 7 recommendations were delivered. That's quite sad. And we suffer because of that. We were promised additional theatres for safe local surgery. What did they do? They removed it. We want people to actually realise that, our rights need to be satisfied and fulfilled. We understand we can't have everything here, but we can have more than we've got, and that's what we're asking for. Thank you.
Hello folks, Simon Torrey. Been a member of the Health Forum for 5 years plus. Can you hear me at the back? Migration of local services. There's our hospital sign. Am I going page down, Anthony, on this? The clues in the title. Built as the Bridlington District Hospital. 2017 was a watershed year for this town, for two reasons. It was the reason the NHS decided we no longer needed palliative care. That was the same year that the then CCG made the statement that East Riding's greatest health concerns lay in Bridlington and Driffield. So what we're looking for is safe local hospital care, but we see that being eroded. And we see it move to Scarborough, initially then Malton, then York. And let's be very clear what our aims are, because there's been a bit of mischief going on, and the ambitions of the forum have been, I'll say, misrepresented. We're not looking for a return of A&E, because it's not safe. We are not looking for intensive care. We are not looking for brain surgery or heart surgery or any specialist services. We agree with the decision, and we need to be honest with ourselves. It would be unsafe to have those in a small place like Bridlington. If I'm in a car crash, I want to be held by someone who's done the job a few times. That's specialist care. But what we are looking for, the operative word is safe. But we are increasingly seeing Bridlington District Hospital used for trust-wide patients. Now that's good, but it's not what it was built for. Safely. There's loads of great stuff going on at the hospital. We should rejoice in it, and it is safe. World-class orthopaedics, but we could do a lot more than we are doing there. 73% of that's for North Yorkshire patients. That doesn't matter, provided we get some cover. We've got a half-used ward supporting those surgeries. We'd like it fully used. We've got a fantastic regional stroke rehab unit in Johnson Ward. That is doing great stuff for the region, safely. We've got a full, misnamed I think, Bridlington Care Unit, predominantly for North Yorkshire patients waiting a care package at home. We do have Bridlington patients in there, but it's predominantly North York's based. And recently on the previously unused Thornton ward, we've got a health academy to help train new entrants. That's all good stuff. We applaud it. But it does beg the question, why does it have to be either one or the other? Why can't the hospital do this good stuff and the local stuff that we need? And what makes people mad, Andy referred to the green elephant, is waste. 1.7 million miles a year travelled by Bridlington and Driffield residents for outpatient care that used to be in Bridlington. What makes them even madder is when they look at the waste in the hospital. Shepherd Day care unit, local theatre, very little used. Lloyd Ward to support it, I don't think there's a bed left in there. Buckrose Ward, empty. The physio unit, empty. Thornton Ward, empty apart from the care academy. Our question is, why not both? So maybe the answer is that Bridlington no longer needs the healthcare. Maybe we're all healthier and happier and living longer. Well, yes, we do need the healthcare. Melanie, you know I'm going to do some numbers here. Because here in Bridlington and Driffield, and it's recognised, and the numbers I'm going to take you through are not my numbers, the health service numbers. East Riding's poorest health is in Bridlington with a hospital in decline, managed decline. Life expectancy. Looking to the right in the green shaded area. Bridlington South, the lowest in East Riding, closely followed by Brid Central, Brid North. If you go to Willoughby, if you live in Willoughby, you live at 10 years longer than a Bridlington male. That's not acceptable. And Martin, forgive me, I couldn't resist putting in Harrogate. Martin is from Harrogate. There it's 13 years longer. That's unacceptable. If I look at emergency admission to hospitals, again, looking on the right panel in green, it's the highest for Bridlington residents. If we compare Beverley on the left and Bridlington South on the right, it's double in Bridlington South. How can that, Beverley's not that a million miles away. How can there be that phenomenal difference? If we look at long-term disease, again, in the green panel I'm looking at Bridlington, the centre Beverley and the right Goole. For every measure, cancer, stroke, hypertension, lung disease, mental health, diabetes, dementia, they're all much higher, more prevalent in Bridlington than anywhere else in East Riding. And by the way, the clue's in the title, long term. If you've got one of these illnesses, you're in for a long journey, needing years of support. This isn't a one-off trip to Bridlington for a hip replacement. It's not a one-off. You're going to be doing it for the rest of your life. But those services are being removed or have been removed. If we look at outpatient clinics, they're very closely associated with long-term illness, and we're approaching 100,000 referrals every year for Bridlington Driffield residents. And I'm going to compare what's happening with those residents get care. I'm going to show you a graph in a minute. The yellow bar is people travelling to North Yorkshire. The green bar is people who used to be and should be seen in Brid where possible. So it's slightly complicated. The green bar at the bottom is Bridlington, the yellow bar at the top travelling to North Yorkshire, and the red line is showing the decline. The first bar is pre-COVID. That's your reference point. Even then, more than half of the services had been removed from Bridlington. This is 2019-20. Half in Bridlington. But that should be back at 80%. If we look at the year just ended, it's a different story. That's where your travel comes in. We've had a gap that's grown, even in those few years, by over 5,000 services lost in Bridlington, patients now travelling to North Yorkshire. And don't forget, if you're fit and healthy and you can drive, that's one thing. If you haven't got a car, if you're retired, you're elderly, you're deprived, and you've got one of these long-term illnesses, this is a long haul. That's why we need those services locally. Bridlington. A bit depressing this slide unless you're an undertaker. Good place for business in Bridlington. If you look, green bar on the right, more people died every year in Bridlington than anywhere else in the East Riding. So how is it that we're the only place without enhanced palliative care? Anthony will tell you he visits patients in Scarborough Hospital who die there every week, whose relatives have to travel to see them in the final days, and God forbid they don't make that last trip in time because it's so far away. So, this is not new. None of this is new. These red flag issues have been raised since 2017 that I'm aware of. We've only just done a few of them. There are loads more, hundreds saying the same story. So, what was the response? The response seems to have been migrate services away. Initially to Scarborough Hospital. All eggs in one basket. A new term in the NHS I learned this week, it's called corridor care. That's what's happening in Scarborough. If you're out of the ambulance, you're in a corridor, it's on its knees. Yet we've got all these facilities in Bridlington not being used. But now, because it's on its knees, we're going further afield. Malton, York, and would you believe it or not, we're even being asked to travel to Selby now for outpatient appointments. That's not right. So it's time to level across. Just reading my crib notes. If you've not read it, when you get home, type in the NHS Constitution into your search bar. I did it again this morning to check I wasn't totally insane. It says the NHS belongs to the people and everybody counts. Well, I hope that includes bread. It puts the needs of patients and communities before organisational boundaries. Well, we've got a problem with the boundary. It's 4 miles north of hospital and it's called the East and North Yorkshire boundary. It says it maximises resources for the benefit of the whole community. Well, there's so much waste in Bridlington Hospital. And by the way, a word of warning, please don't anybody patronise me by saying we can't recruit in Bridlington. You will never recruit in Bridlington while you've got the sword of Damocles over it, while you've got staff worried about their long-term jobs, while you don't advertise jobs in Bridlington. So please don't mention recruitment. It really gets me riled. It says the NHS is accountable to the communities and patients it serves. Well, that includes us, and we need to hold those in authority to account. And finally, just one quote, it makes sure nobody is excluded or left behind. Well, I tell you what, folks, I feel left behind. I feel this community is being left behind. So it's time to level across. We want some more investment in Bridlington. We want some more moving across to the coast. It's time for equity of provision. Equity meaning if you need more, you get more. Not equality, equity. But most important, it's time for you to have your say. We've got some very kind guests who've come to listen. So thank you for listening.
Thank you to Andy and Simon, and welcome to Simon Cox. Pleased that you've managed to get here, Simon. Folks in the audience will remember Simon Cox is the East Riding Director for the Integrated Care Board. So we're privileged to have 3, in fact 4 with Melanie, special people here today. So we've got some roving microphones. We've got 40, 50 people in the overspill room across the way. If any of the folks in that room have got questions, we'd request that you come to the doorway here to use the microphone in this room. And then I'm going to ask our speakers whether they would mind just lifting up their chairs, turning them around so that you can see who's asking a question, and it will just facilitate our discussion this time. I'm sorry we haven't got more chairs, but as you can see, we're limited. At this point, I'd like to throw it open to members of the public to make your comments and ask your questions, particularly about the hospital. Lady there is a microphone.
The gentleman before who mentioned the staff, I did think that was going to be an issue, because that seems to be what we're always told. You can't recruit staff. So you've got an empty ward, but you can't recruit staff. But that's a good point that he made, that if we have a growing place, people will want to come and settle here. If they come thinking that they could be out of a job in 6 months, they're not going to come. So that was a very good point. We have a large ageing population here. And I can personally speak of friends who are in hospital with a partner unable to visit Hull because they can't drive. So we've had to organise between ourselves a daily trip of about 60 plus miles to get to give the spouse a visit. What I think we should have more of here, surely, is facilities for the type of illnesses that older people get that will put them in hospital, because that's what we need most of all. That 44% of, was it Bridlington North or South?
Northward,
okay.
yes.
Well, yeah, we live in Bempton, so we come under that one. And, you know, I think that should be catered for, and I can't believe the state of this Bridlington hospital, and I hope that you people at the front have got something sensible to say to me as to why nothing is being done. And I know this group, and thank you for what you do, has been working at getting something here for years and years, and we just get fobbed off. So I'd like to see something positive being said today and started today. Thank you.
Thank you. Can we have some other questions?
It really saddens me. I started working at Bridlington Hospital in 1989 and worked for the hospital for 25 years. My biggest sadness in it all is that as soon as York started to look at Scarborough and Bridlington, Bridlington was seen as the cash cow. Other places have got robotic surgery, have got loads of building and development, and I think all our money that went into Bridlington Hospital cannot be restored because it's all being taken at the moment. I think the only thing that can be done is if government gives extra money for Bridlington, because I don't believe that the money still exists for Bridlington to be properly developed in any real way. And I was one of the many people who, working in Bridlington, regularly had to go through to Scarborough. You never knew when you were going to be asked to go over there. I can see why they haven't retained staff. There were a lot of people left wondering whether they should just give up and go and live in Scarborough, because they couldn't go to Bridlington Hospital and know that in the evening they could even pick their own children up from school. It's a ridiculous state where the staff are continually asked to work elsewhere.
Thank you. Good point. We would be in favour of having an expansion of surgery locally, and so people are not needing to go to York for operations.
Hello everybody. I was privileged to be a site secretary when that hospital was built, and I was even more privileged to have met my husband, who was in charge of all the brickwork for that hospital. But in June of this year, last year, my husband was not allowed a bed in Bridlington when he had a fall. He was transferred from home to Scarborough to home. And then home just said, I'm sorry, he can't go back to Bridlington, it's not allowed. Now, if patients are being told they're not allowed to go back to their hometown, and I kept saying he'd get better care in Bridlington, which he would have. I didn't get better care in home. Why are patients being turned down the privilege of being in a hospital in their hometown? Is this going to go against everybody who wants them to stay alive?
Thank you for that question. I think that's to do with it. That's to do with integration between different trusts, and that's an important topic.
I believe our central government has said they're going to build 40 new hospitals. They wouldn't need to build a new hospital in Bridlington. We've already got one. They just need to put the services within the building.
Thank you.
Hello, just a simple question really for you. We know that it all comes down to money, and if we assume that the people that in Bridlington are entitled to just as good a health care as anyone living in Beverley or Malton or York or anyone else, and we assume that the care board doesn't think Bridlington citizens are some kind of second class and don't deserve as good health care, then when the calculations have been done as to move this service away from Bridlington, the true cost of that is not calculated. You'll do arithmetic and you'll say, well, we'll save a nurse here and we'll save a doctor, and perhaps that'll save a little money. You don't do the true cost. What if you included in that a bus service every 15 minutes from Bridlington to Malton to York to everywhere you send everyone, and costed that up, and then you'd find, actually, we don't save any money here. This is an extra cost, and all we're doing is putting that burden on the people that live in Bridlington if they can afford it. And if they can't afford it, well, they just can't go. Because people to go to Malton from here is not an easy task. And yet, it's just ignored. So the true cost of moving a service out of Bridlington is not included in the calculation, because that's just put upon the people that live here to sort it out themselves. And I'd like to emphasise that when a service is moved, the true cost is really put in there. The cost of people's lives, the cost of people's discomfort, the cost financially of trying to fund travelling. As you heard earlier, 1.7 million miles of extra travel is put on. That's not costly to the saving. And that's going to cost a lot more than a saving of a few nurses or whatever. I went to the hospital this morning, and there was a whole ward potentially with probably 20 beds in it, and all there was a big empty rooms with a consultant just talking about my knee joint. And yet, the facilities were superb. It's just not used.
Thank you for your comment.
I'd also like to point out that they're building a lot of houses and also Strawberry Fields. There's loads of houses being built.
You're right, they're going to be an extra nearly 3,000 homes in Bridlington.
Where are they all going to be? It would be better if they made Bridlington so that we can treat them in Bridlington.
Yeah, we would agree with that, and we are concerned that the previous CCG incorrectly reassured the Striding Council about the provision of services locally. And there's very little in the local plan about this expansion of homes and the required infrastructure for health and dental services.
I would like to know why we have to wait for an hour for an ambulance to get from Scarborough to Bridlington when an 82-year-old man is laid on the ground and we have a hospital 5 minutes up the road. Why can't an ambulance be sent from there?
I'm not sure the answer to that. It may be that ambulances were spread around and that was the nearest ambulance.
Just one quick one, Nelly. It's regards to the population. In 1988, when they built the new hospital, the population of Bridlington was 27,000. Population now is nearly 10,000 more, and yet the services have been greatly reduced. Can any of the people in the front tell me why we've got a situation where we've got a population what's increased by 10,000 or 40%, and yet our services have been diminished? Thank you.
Thank you for your question.
Now, there's a question from the overflow room, if that's possible.
Good afternoon. I just wanted to know what the fascination is about people being travelling to Malton. A little backwalk to the hospital and we've got nothing. And also, I think the hospital management should be up for review for the jobs every 3 years. So if they don't do the jobs right, out they go. Thank you.
You're quite right, it is very costly to get to Malton. If you haven't got your own car, it's over £100 return on train and buses. Next question, please.
Hello there, good afternoon. I just want to say, basically,
that the GP services in Bridlington are appalling. You are very lucky to get an appointment. If you do get an appointment and you need a referral, the chances are you'll see a locum who doesn't know the area, and he sends you off to Scarborough, or Hull, or York, and you have to point out to him that you can get those services in Bridlington. He doesn't know that because he is not a regular GP in this area. And what's going to happen when all these new houses that are being built, hundreds of them, who on earth is going to get an appointment or a referral then? That's what I want to know.
Right, thank you for your question.
Hi, good afternoon. I was very fortunately, quite recently, able to get surgery here at Bridlington Hospital for my knee, and I have to say they were outstanding. I was the only patient in the bed that evening. There was nobody else. I got 100% 5-star treatment that evening. We need the heart services back. We've had some of the top heart surgeons in Bridlington Hospital. Don't give me any rubbish, we can't get them. Some of the top heart surgeons that treated my own father. The palliative care unit here, the cancer ward, was superb. Bring it back, stop talking about it, bring it back, bring the heart service back, get people back into this town. We need action, we don't need talk, get on with it and get that hospital moving.
I've got a range of medical problems, mobility, I've had cancer, I've got mental health problems, and I'm having to travel to Scarborough, York, Hull. I've got 2 appointments in February. One's on the 7th in Scarborough, and then the next one is in York on the next day, and then tomorrow I have to travel to York to the mental health service, which I've been waiting for a while. I'm now self-harming, and I'm struggling really bad. I've fallen twice, that's why I've got 2 black eyes. The doctors here, since I've only lived here a year and a half, and the doctor's service here is absolutely appalling, the way that they speak to you. I had a conversation with a doctor on the phone, and he basically told me that I was twisting his hand up his back to get what I wanted because I was in pain, and they've cut all my medication down, and I understand all this opiate thing, I get all that, but I've been on this for 10 years, and when I moved here they cut it right down to 8 milligrams of codeine. I'm on morphine patches, they've cut them right down. I'm on Oromorph, they've cut that right down, and I'm struggling real bad with pain. And this doctor said to me that you people think you can twist the doctor's arm up his back and get what you want, making me out to be like an addict. Obviously, I'm going to be addicted to opiates because I've been on them for so long. You can't just take people off them and expect them to be not in pain. And the travelling situation for me is really hard. I have a stick, I'm not very mobile, I fall a lot, and I'm having to travel to hospital after hospital after hospital, but not round here. It's always York, Scarborough, Hull.
Yeah, thank you. You made your point very well, and you represent, I think you represent a lot of people in Bridlington who do struggle and who often don't come to meetings like this, so thank you for your contribution.
Hello there. I think the fact that there is a Bridlington Health Forum, that it gets to turn out like this, is a clear indictment of the failings of the managers that look after the health services in Bridlington. And the gentlemen that are going to say their pieces up there, I've listened to so many of these speeches where they tell us how lovely it's going to be in the future. I wonder if each of them, when they start, would tell us what they have actually done in the last 12 months to improve services at Bridlington.
And one of the issues I think the GPs are having as well at the moment is they don't seem to quite know where to send people for treatment. And because we seem to be in the devil in the deep blue sea, I had to have emergency scans done for cancer. And so they decided to put in requests for both Scarborough and Hull and see which one came through first, because they didn't know. And that is such a ridiculous situation to be in, and such a ridiculous waste of money and resources, and that one of those scans could have been given to somebody else. To me that just seems completely illogical. And if we had those resources here, it could have been done locally, it could be done quickly, and it could have been done efficiently. And I just think that's ridiculous.
Thank you for that point. We are campaigning for more local diagnostics because a lot of people are travelling for diagnostic tests, and Simon and others will be able to comment on that later. We've got time for a few more questions, I think, because there's so many questions. I think we should hear. This is an opportunity for you to have your say. We need to hear what you want to say before we hear from our special guests.
I have an issue with the lack of communication between the two trusts. Historically, some of us have been treated in Hull, HRI or Castle Hill, for certain conditions. I recently went to Castle Hill for a follow-up appointment, and the consultant couldn't carry it out because he didn't know what I was being treated with at the eye clinic in Bridlington. He tried to look it up on the computer, but it wasn't available. Eventually, a nurse went and made a phone call and came back and said that it wasn't dangerous and that the procedure could go ahead. Similarly, I've been treated in the neurological department in Hull, and then, successfully I should say, I'm on constant medication to control that condition. I then was treated differently for a different thing in York, and was given medication which it turned out actually didn't work well with the medication that I'm on in Hull. That resulted in me having to go back to Hull for a recent brain scan, that cost money obviously, and that needn't have happened if there'd been some communication between the consultants. I'm sure I'm not the only one who's had these problems, and something needs to be done about it.
Thank you, yes. The Integrated Care Board was formed with the intention of improving those kind of problems, but we haven't actually seen any progress on the data sharing from the sound of it. So thank you for sharing that.
One of the things that hasn't been mentioned from in the questions, although it's mentioned on the presentation, is dentistry. We were very lucky about 5 years ago when our dentist closed down to be able to get an NHS dentist in Driffield. Last week I was at the dentist, and there was a guy that I knew from Bridlington was coming and asking if he could sign on with them. He was told that practice had 4,000 people on its waiting list. When he asked what the turnover was, he said the last time we took anyone off the waiting list was 2020. So why the hell can't we get dentists in Bridlington? And again, I don't go with this thing about recruitment. If a dentist sets up in Bridlington, he's got patients. You would have patients queuing at his door to sign on. So why can't we attract dentists to Bridlington?
There is a national problem. I've said it publicly before, NHS England have failed to sort the dental contract to keep NHS dentists within the NHS. That's part of the problem. Obviously Oasis left over a year ago, leaving thousands without a dentist. The BBC has recently highlighted the 8.5-year wait to get a dentist in Bridlington. The situation is dire, and we're fully aware of the problems. Thank you.
My husband saw a cardiologist in February last year. He then got a message in May to up his medication from 3.25 once a day to 12.5 twice a day,
and he's carried on, and he's never seen anybody. We rang up in August to say, is it being reviewed? And they said, oh, they've left, and they haven't assigned him to anyone. We got panicky about November, so we went privately, and he said, I can't alter it because you've been way overdosed. We went to the doctors in Bridlington. They said, you're way overdosed, but I can't change it until you see a cardiologist. So we sort of beat his fire. Then I kept ringing Scarborough to try and get a cardiologist, and they said, somebody will ring you on 27th of December. Well, that was cancelled. Then they said they'd ring on the 7th of February, this next February, and I said, no, he needs a face-to-face because he's been overdosed by 5 or 6 times, and it's not helping. And so we finally, hopefully, he's getting a face-to-face, but he's been overdosed since last May with a text message to do this medication, and it's just not helped. It's not helping because he needs to see a cardiologist. So 3 doctors have said we can't change it.
Yeah. Thank you for raising that. I think there is an issue when consultants retire, with them not actually being replaced with local consultants, and then patients are distributed between existing consultants, and often it means going to York or Malton or further afield, and we've had a lot of complaints about that kind of thing as well. And that's why we feel that the Trust needs to commit to actually providing the full outpatient service along the coast.
Good afternoon, ladies and gentlemen. I would just like to thank you all for coming today. We've got a firing line in front of us now. I just need to ask you 2 questions. 1, when are you opening the hospital? And 2, how long is it going to take to open it? I've been here. Nobody's asked that question yet. I've lived here in Bridlington all my life. We've shut 3 hospitals: Lloyd's Hospital, Benton Lane Hospital, and the Avenue Hospital. We built a lovely hospital up there. We had everybody in that hospital to serve Bridlington people. We've got nobody in it. So, when is it opening, and how long is it going to take you to open it?
Thank you. There's 2 people who've had to leave, so I'm speaking on behalf of them. I've had a lovely gentleman called Mr. Brian Hayes, who's 89 years old, who served in the RAF. He told me that recently he's struggling with money as he still has an interest-only mortgage that he's having to pay at 89 years old, and that he went to his dentist, called My Dentist in Bridlington. For 12 years he's been an NHS patient. He recently went and he was told his treatment that he needs to have done will now be private, and it's going to cost him £900 just for 2 teeth. The man cried in front of me, which tried to get emotional, before he left. And it was really hard to see that dentistry is a huge issue in our town. I've got children, and many people here have grandchildren and children. Dentistry needs to be looked after.
Yeah, and can I just comment on that? We did have a dental access clinic at the hospital, which we no longer have. There was an issue about ventilation within the dental area, and that's not been fixed by the Trust. So we have lost the dental access, the surgery there, and the access clinic.
At the back, Emily.
Okay.
The second question is for a lady called Alison. She said, what can we do as residents to get together and get the government to invest more in our community?
Just one more question. We'll finish at 2 o'clock and then allow our special guests time to respond.
Good afternoon, everybody. That gentleman over there, I was born in Bridlington. I was born at the old Avenue Hospital.
Here.
Thank you.
Yeah.
I've grown up in Bridlington, and when I saw this new hospital come, I thought, brilliant, you know, everything's going together. and it's declined dreadfully. And what I really want to know is what we're going to do to build those services back up in Bridlington. Because I want to die in Bridlington, and God help, that's not going to be for a lot of years yet. But please, what are we doing to build the services back up again? There's been a lot of talk, but what we want to know is what action we're going to be doing to get the services back in Bridlington.
Can I just say one of the ICB's aims is to ensure that we die well, you know, and where we prefer to die, and that is a challenge for the ICB. But there is now national legislation which exerts a bit more pressure, and it raises the power of the public. So yeah, the public do need to get involved with these issues, because it's only by us raising our voice that things will change. I believe they will change. The system is obviously under a lot of strain, but some hard decisions are going to have to be taken to enable a levelling across to occur, to actually bring about equity that we heard about earlier. Okay, so thank you very much to our esteemed panel. Thank you for coming. Martin, would you like to respond first of all?
Okay. Do you want me to stand there? I started as chair of the trust on the 1st of November, and gentlemen over there, you'll be pleased to know, as a 3-year appointment. So we will see whether I'll be back here in 3 years' time. But in all seriousness, I have worked in North Yorkshire and places, but I am not familiar with the Bridlington patch, and I've been today actually to Bridlington Hospital this morning for my second time, and I also attended the orthopaedic clinic, but not as a patient, but to visit, and saw for myself, you know, that a large part of the ward was used for storage as opposed to an orthopaedic outpatient clinic. But the outpatient part is used 5 days a week, the nursing team told me. There's a number of points, and I'm grateful to the 3 members of the forum who gave the presentations, you know, about issues to do with Bridlington. And a number of things that struck me. You mentioned Professor Michael Marmot, who's absolutely one of my heroes. I should say I worked in the NHS for 49 years from 1972, and I retired a couple of years ago, but was tempted back to try and support the Trust, address the challenges it is facing. And Michael Marmot, you know, his expertise is in about tackling health inequalities. And he, from memory, has 6 priorities, the first and foremost of which is giving children the best possible start in life. And that is particularly for the first 1,000 days of a child's life. But nowhere in those 6 priorities is boosting hospital services. And I am learning, I've listened attentively, you know, not only to the presentations, but to the questions. But from my overall knowledge of the NHS, I think the issue of utilising and getting back to 220 beds, which I think the hospital opened with, it is not going to happen. That is not a realistic aspiration. Because since 1988, healthcare, can I just, I've listened patiently, and I'm going to try and respond to, in outline, the key points that have been made today. What, I've lost my train of thought now.
1988.
Yes, healthcare has changed. So I visited the orthopaedic elective ward this morning. They're now discharging some patients who've had a hip operation on the same day as the surgery. The average length of stay is 1 night. And I can tell you that in 1988, the average length of stay for somebody having a new hip was 14 days. And the fact is that so many techniques have changed. Now, what I think the key messages that I'm absolutely taking away from this is A, what can we do to address the fact that only 50% of Bridlington outpatient appointments take place in Bridlington and not 80%? What can we do to improve the range of diagnostic facilities? Because when you really look at the number of patients that use the hospital, it is for outpatients, it is for diagnostics, and it is for occupational therapy or physiotherapy. It isn't people coming into hospital. So a hospital like Bridlington is never going to do emergency admissions anymore. You know, in 1988, doctors worked 1 in 4 on calls. You know, now doctors work, 1 in 8, 1 in 10 on calls, and unless they do, you can't recruit to the vacancies. And that's even in cities, not in a rural or coastal area like Bridlington. And I'm not trying to annoy you, but the workforce issue is a very big challenge, especially for doctors. And because of the rotas, the reduction in working hours, and the shortage of doctors in this country, the issue of working conditions and environment is really important for them. The underutilisation of space, I absolutely agree, is a complete waste. And if we can't use them for beds, and I'm not saying how many wards there should be or could be, but I'm just saying it's unrealistic to expect to get back to 220 and the 8 wards that there were. It is what else needs to take place that would be a benefit to the community in Bridlington. You know, I really liked the presentation that you gave, Simon, to indicate the health status of the people of Bridlington. And, I've been very also taken aback by the difficulties in accessing regular GP surgery, GP appointments, GP surgeries. Absolutely shocking, no NHS dental care. These are all fundamental things that contribute to, or don't contribute to, average life expectancy. So it is, what can the facilities of the hospital be made available to community groups, voluntary organisations, other health providers? And you read out sections from the NHS Constitution, and it said organisational boundaries, should not be a barrier. And actually, walking around Bridlington Hospital this morning, I was struck by, there's an independent company that provides the renal dialysis service. There's a community interest company that provides a whole range of community services. And there's another, the Yorkshire Ambulance Service have a base there, and there's another provider that I can't remember the name of as well. So that the Trust is making space available to other organisations, because from your point of view, it doesn't matter at all what the provider is. What matters... It's not privatisation. Well, it might be a private... Hang on, just hang on. It might be a private company that does the renal dialysis service, I don't know. But the others are either fundamentally part of the NHS, or what is called a community interest company, which is a non-profit making thing that was set up when primary care trusts, especially in Hull, stopped being a provider of services themselves. So I can assure you, it's got nothing. It's not about privatisation. And there's another organisation that does the urgent treatment centre and GP out of hours services that are there. So from a trust point of view, we will absolutely work with you, Simon, as a commissioner, and the local authority to look at how we can maximise the use of resources, as stated in the NHS Constitution. It's an absolute waste of having the empty space when there might well be other things. And with your local knowledge, you will have a much better idea than I do, or many people in the Trust will have, about what useful purposes the space can be put to.
Put it back to a hospital. Put it back into a hospital. I asked the question, when are
I
you
did.
going to open a hospital, and how long is it going to take you to do it? All you're telling is, excuse me, friend, bollocks. You're not giving us what we want in Bridlington. We want that hospital open. When are you going to open it? And you need to answer some questions as well, Jim.
I can assure you it is open. Two of us have been there this morning.
If you fall over out here today, where do you go?
Well, it depends how bad you're hurt. Are you
An ambulance will pick you up and take you straight to Scarborough. They'll take you to Bridlington. You're not in the real world, mate. You don't have to only been there twice.
Hang on, First of all, hang on, these people have, I'd like to thank Martin, he's come here to face us, that's you and me, but I've been listening to what he's been saying, and I have to say to you this isn't about 220 beds.
No, it's not.
Those days have gone. Melanie, who we've met with, has said to us, we need to be honest with you folks, and I'm going to be bluntly honest because we need to understand. I don't want an A&E inbred. I want someone who's done it before. I want someone who's got the gear, the kit, the experience, the ITU round the corner. That is not coming back to Bridlington. I don't want to be at the hands of someone who did it once last year and cocked it up. So what we do need, what happens
if somebody has a cardiac arrest in Bridlington and you cannot get an ambulance for half an hour or an hour to get them to Scarborough?
the answer to that, no, hang on. I never thought I'd be here defending your trust, but here I found myself. What I'm saying to you is, it would be great if every town could have its own full-blown A&E and its ITU. The answer to your question is, if you mentioned a heart attack, you actually start receiving treatment in the ambulance by trained paramedics. That's the answer. What I will say to you is, Martin has said he agrees there's a lot of waste in the hospital. Martin has said that space should be used for the benefit of the community. And what I'm saying to you is, let's see what can be safely done in the hospital, because if it can be done, it should be done. Where the line on safety lies is with the medical experts. But for me, I've been honest with you, I do not want to see an A&E, full-blown A&E in Bridlington, because I want my family and me to be looked after by experts. I just give Martin the space that he needs. Martin, do you wish to continue?
So you need beds in wards in order to be
hospital? Are you saying we're just going to have clinics with all these different community groups and whatever? Is that what you're proposing? Because you've not made that particularly clear.
I'm not proposing that at all, but there is a day surgery unit at the hospital now, which is underutilised, and the orthopaedic theatre, I believe, is more or less fully utilised, and we need to check up on that. But there will always be empty beds on the orthopaedic ward because there is only one orthopaedic theatre, and at the hospital there is only one general theatre. So that is how the hospital was built, only 2 theatres. Sorry. Well, we are where we are. I just want to respond to the lady whose husband had a fall and was Hull, and Hull said we can't transfer people back to Bridlington Hospital. The stroke and rehabilitation ward does take people from Hull Hospital if they are a Bridlington or district patient. It is to do with the particular, I guess, pathway, but to say it is a different organisation is why it doesn't happen is not true. We do work cooperatively with Hull.
Can I just tell you what they offered him? They offered him a trip to Scarborough because Scarborough could possibly get him transferred back to Britain, and it would have put him under a lot of pressure because it was actually a dialysis patient. And the dialysis unit in Bridlington is not run by the NHS.
No, I know.
It's run by Fresenius.
Yes, I know.
He's been on dialysis for 8 years, so I know that's his inside out.
Yeah.
Because I was his transport, because he couldn't get transport. But I was told categorically by the matron for Ward 50 in Hull, which is the dialysis unit in Hull, that he could not have a bed.
Sorry, I thought you were I thought he was recovering from a serious fracture or something like that. I didn't realise.
No, he was a dialysis patient. He had a fall.
Okay.
So, and he banged his head when he came home from dialysis on the Monday. He was taken to Scarborough and transferred to Hull because that's where the dialysis was.
Yes.
But he charged him the day after saying that he could go for his dialysis on Wednesday as normal in Bridlington. And he collapsed through the night and had to go back. And so they gave him a bed and he spent a month in that bed. They discharged him on the 12th of July as A1 fit, and on the 13th of July he died.
Well, I'm obviously mortified for your loss. And the issue of the lack of capacity in renal services in the whole of the York and Scarborough Trust catchment population has already been raised with the Board of Directors through the Council of Governors and others, and it's one of the things that we'll be talking to Simon and his colleagues about at the Integrated Care Board, because it's a service that is commissioned by the Integrated Care Board, and there's a whole raft of different providers. It's
I mean, from my point of view, all I want to do is to make sure it doesn't happen to somebody else.
yeah, sure.
Thank you, Martin. And with mention of the Integrated Care Board, I think we need to give some time to our other guests to comment generally about what they've heard. But in relation to the number of hospital beds, I think our country is lagging behind the average now in Europe on the number of beds, and within the OECD countries. And so that you might have a point there, but there's no doubt that the turnover has increased substantially over the years, we still face a population here in Bridlington who are not getting the local care that they expect, and that is the key issue. So Simon or Dave, who would like to go first? Dave? So just to reintroduce Dave. Dave is the portfolio holder for adult health and social care at the East Riding of Yorkshire Council.
Yeah, thank you very much indeed. Can you hear me at the back? Yeah, thank you. Some of you may remember I came here just before Christmas and I listened to some of the stories, and I will openly say I was actually harrowed by some of the stories I heard, and I found it very deeply distressing. So, as a portfolio holder or as an elected councillor, our roles are very, very sort of tunnelled really. We're not decision makers for the NHS. Our role as elected councillors is we are influencers. So I took that influencer role away after listening to your stories, and I've been working very closely since then with Simon Cox and Melanie and many others in the health service to see what can and can't be done. Now, there's a lot of things in the pipeline, and I think it's only right in this forum to tell you what we've been doing and where we are. But please bear in mind, we can only influence. One of the things that we've done is, you may have heard of a guy called Andy Kingdom. He's the Director of Public Health for East Riding Council. He's actually put a presentation together talking about the health inequalities in Bridlington, which we all know are well found. That presentation is going to the ICB and the ICP in March. But more importantly, I think it's 2 weeks on Friday, we've got a meeting at County Hall with the Chief Executive, myself, the DAS for the authority, Melanie, Simon Cox and some others, to say what is possible, what can we influence from an authority to bring to Bridlington, what is possible, what isn't possible. And that's where we're heading at the moment. You know, I mean, I think anybody sat on this panel today can't help but take away some of the stories that we've heard. But we are trying to influence, and we are going to be working hard. And I say, within 2 weeks, hopefully we'll have some meeting to say what we can and can't do. Just to bring things back though, I'm like Simon. You may or may not recall, my whole working career was in the NHS. I was a nurse, I worked in intensive care, chiropractic intensive care, A&E, lots of other areas. There are some specialisms you would never want to come back to Bridlington. If you're having a coronary heart attack and you need a stent, you don't need to be in Brid. You need to be in a specialist centre where you can get stented. You know, if you're having cancer, you need chemotherapy or radiotherapy, you need to be in a bunker. You need to be with those specialist services. What I take away from here, and I take away from listening to you guys, and I hope that the panel will take it away as well, is some of the more routine surgeries that are safe, that can be delivered. Hopefully, we may can see those return. But I say, my role, as much as the elected member's role in this audience, is to influence, and that's what I'll be working on. So hopefully, when we meet next time, there may be some progress. Thank you very much.
Thank you, Dave. We appreciate your interest in Bridlington's situation, and also that you've postponed your holiday in order to come today, so thank you.
Not that you're bothered by flying 4 hours.
So can I invite Simon to comment? Simon Cox is the East Riding Director of our ICB, Integrated Care Board.
Thanks, Anthony, and thank you for the invitation. Can you hear me? Firstly, I think one of the questions was, what have you done for Bridlington in the past 12 months? I think it's a valid question, because we should all justify our jobs and what we get, the roles we have in the NHS. So I started working for the East Riding at the back end of 2022, so I've been working around this patch for about 18 months, worked in North Yorkshire for a period before that, and did come across Martin in one of his previous lives as the Chief Executive at a mental health trust. So one of my first priorities, or my first priority for Bridlington, was trying to start to sort out primary care. Because although a lot of the focus this afternoon has been about hospital services, probably about 90% of people who go to an outpatient appointment do so following a referral from a GP. So if you can't access your GP, it's actually going to be quite difficult to get into hospital services at all. And what was the situation probably about 2 years ago was not the best provision of primary care in Bridlington. I think many people, certainly a lot of the surveys of patients, was not a great experience of GP services. I wouldn't for a minute say they are perfect now, but one of the things that we did do earlier at the last part of last year, and which concluded in April 2023, was merge 4 of the surgeries together. There were 3 surgeries, many of which you'll remember, Wellsview, Fieldhouse and Practice 2, all of whom were quite unsustainable, had very poor access, poor patient experience, and indeed all of the people who ran those services said they actually couldn't continue to provide them. The practice that was probably the most stable is the one that's now named as Partners Ready and None, what was previously Practice 3, which actually was probably the best of the bunch, and all those surgeries were merged into one large practice. We now have 2 practices in Bridlington. Again, I wouldn't pretend that access or the services are perfect, and I'm happy to pick up any individual cases of particularly poor experience. There's no excuse for GPs or nurses being rude or talking inappropriately to people, but obviously I can't now comment on any individual episode of care. But what we have got now in Partners Ready and None is probably some of the best access to general practice in the whole of the ICB. It's not perfect, but the amount of appointments and bookings that are arranged are far greater than they were even before COVID. We're also doing a lot of intense work with Humber, the other large practice in Bridlington, which probably their access isn't quite as good as the other practice. There's more work to do. And I think we recognise that, and that's been discussed in public meetings, and we are doing ongoing work with Humber, and there is a report that's going to the next council scrutiny committee in a couple of weeks in public, which Dave will be at, and we'll explain some of the actions that we're taking to improve access in Bridlington. So that was the first thing for me, was primary care. Again, there's still a lot of work to do around that, and what I said at the scrutiny meeting 2-3 months ago around primary care was that this is an 18-month programme. We're not going to radically recruit loads more GPs or all that staff overnight. It will be a long programme. But I think that the point that I think Simon made earlier about the hospital is that people will come if there's a vision and there's a commitment to good quality services. Once you've got large, stable practices, people will come to work in them. GPs won't, or nurses or other specialists won't come to work in practices which are small, which are falling over in poor premises. So that's the first priority thing, is around primary care. It's not perfect, there's still a long way to go, but we have made significant progress. And actually, I think when we've spoken to a lot of people from Partners Ready and None, many of them would say their experience of care is actually quite good. So,
Can I just say one thing? I actually moved surgery this morning in 10:08, and by 10:30 this morning I saw a doctor, and I would not have had that before.
No. Yes. So. So that was my first priority, and what I said to Simon and Anthony and colleagues from the Health Forum is for the first 6 months I'm not going to do a lot other than try and sort out primary care, because again, yes, outpatient appointments will be great, but you won't get an outpatient appointment at Bridlington or anyone else unless you get a GP to refer you. So that was the first priority, and we have made significant progress in that. We've also done some other areas, like we've set up and now established a frailty service in Scarborough, which again colleagues from the Health Forum have been involved in that throughout the start of that. Going back to Simon's presentation, some of the information on that is really important, one of which was around the differences in life expectancy. And we have to be honest, and Martin mentioned Michael Marmot, the public health specialists tend to say healthcare probably has an impact of about 20% of your life expectancy in your health. The other 80% is a whole range of other factors. So regrettably, it's true that a group of poor people will typically die a lot sooner than a group of rich people. So if you look at South Bridlington, it's not just about healthcare. I'm not wishing to pass the buck, or we've got a job to do to make healthcare as good as possible. But also we have to work with the ICB and the Council of Others, better jobs, better paid jobs, better housing, better access to transport, better access to schools. I was at a session a few years ago with some of the consultant colleagues from York Hospital, and they were talking about Scarborough, about whether to work in Scarborough. And what they were talking about, they weren't that bothered about the hospital, about GPs, about healthcare. If they're moving, what are they asking questions about? Do my family have chances of getting access to a good job? Will my children have access to good schools? And are they places I want to live? And actually, you know, I live in Scarborough. I often walk my dogs on the beach in Bridlington. It's a great place to be, but actually you think about all those other things like schools and all the rest of it. So in terms of life expectancy, it's not just about healthcare, but that's our job. Our job is around healthcare. It's not, you know, we work with others around that. And when that list of conditions that Simon talked about, some of those can be influenced by services in Bridlington Hospital, but a lot of them can't, and the majority of them are not just around hospital services. So again, primary care, general practice is really important. Things like the things that will shorten life expectancy and are the killers of why people in South Bridlington, for example, die much sooner than the average people in Bridlington, in Beverley, are things like cardiovascular disease. That means you need good access to general practice. You mean people managing your blood pressure, putting you on statins, good access to diagnostics. So it's not just about the hospital. What we do, and I think Dave mentioned it earlier, I think we have got a meeting planned in either next week or the week after with Melanie and colleagues from the hospital. From my perspective, let's see how many outpatient services we can do in Bridlington. Actually, it's there as a facility. I think there's definitely scope to do more. It would be silly for me to, you know, promise the earth to you just to walk out of the room. We need to realistically look at what can be provided, but actually there is a lot of scope to do work in Bridlington around outpatients. Diagnostics is another one. One of the other things I'd say we've done over the past year, or probably Melanie's team more than me really, is we now have CT scanning available on the Bridlington site, and that's one of the other things that will help in terms of improving life expectancy, faster access to diagnostics. But it's not, but then I think there's a lot of benefits in having mobile CTs. Partly it means they can cover a much wider population, and also, as one of Simon's slides said, the orthopaedic service in Bridlington Hospital is a fantastic service. You know, I've known Mark Andrews on and off for years. He's probably one of the best orthopaedic surgeons in the north of England. Great service, but about 3/4 of the people accessing that aren't from Bridlington. 2/3 of them are from North Yorkshire. So if you develop big services in Bridlington, they'll be used by people outside of Bridlington, which is a good thing, but actually sometimes the solution to that is also mobile units that can travel around to a number of different areas.
Excuse me, can I just say something? I've been waiting for I've had cancer already, I've got a lump in my stomach, I've been waiting since last August for a scan, which I've got now, on the 7th of February, but when I went to find out about the scan, the doctors, they told me I had to ring the scan place myself, so it wasn't anything to do with them anymore. Once you've been referred, it's not their problem, basically. So,
well, again, I can't comment on individual cases. What is true is that a GP surgery would not have access to the booking in a diagnostic service. So the best thing is for somebody to speak to. I mean, if you want, you know, further advice about managing that, I'll pick it up outside of here. But obviously, I can't comment on your individual case in a public meeting.
Can I just say something, please? I've got serious back problems, and I have to have like MRIs every now and then, sort of thing, because it's degenerative. And I've been told that I have to wait 10 to 12 months for another MRI at Scarborough. Why? Why can we not get these mobile units? Get them to break. Give us what we need, diagnostics to help us. Just the last time that I had a scan, I ended up with a disc on the spinal cord. Now, how do I know that that disc is not on my spinal cord right now?
Again, I can't comment on individual cases or why.
Can we have some mobile diagnostic units? MRI scanners, breast scanners, CT scanners.
There are mobile units that are in Bridlington. Again, in some cases, not all tests or not all patients are suitable for mobile. So again, I can't.
But 10 to 12 months.
Again, I can't comment on an individual case or why that is. I mean, again, I'm happy to pick any individual cases outside of here, or we can do that.
Can I just ask Melanie, come and respond to that then?
I was just going to say, I think for individual cases, it would be much better if we have a separate at the end. Really happy to have a conversation, and then we can follow up rather than doing that in the open forum, if that's okay. So I'll pick up a conversation with you at the end.
Brilliant. What a good idea. But the hospital should have one as well. It's not really, oh well, we'll give you a mobile one some days a week.
Yeah, totally agree.
I mean, yes. To be honest, I think if there was a limit or a much larger amount of capital, then yeah, I wouldn't necessarily disagree with that. But the NHS has to prioritise where it puts investment, and in some cases. Well,
28,000 people in Bridlington. In the next 5 years, when they finish the housing development, there's going to be another 10,000. 3 people per household. That takes us to 48,000, just short of 50,000 people in Brid. Where's the hospital? You can't keep sending people to Scarborough. You're not listening. All you're doing is exactly what the politicians do.
But the pills won't
Get a grip. Well, let's get him out. Vote him out. We've got elections soon.
I'd just like to let Simon finish saying what he was going to say, and then I'll invite a few more comments from the floor before we finish.
Yeah, I mean, I won't take many more of your time. Just to sort of repeat, I think that in terms, just to repeat, I think in terms of improving the health of the population of Bridlington, it's not just about hospital. There's a lot of work outside of that. Probably 90% of the daily contacts that people receive from the health and care system don't happen in hospital. I mean, people's homes, they happen in care homes, and they happen across a whole range of other services. And particularly for a population like Bridlington, which is elderly, has a net inward migration of the retired population, social care is one of the other things that's fundamentally important to the people of Bridlington. What I would say, and again, you know, Dave mentioned it, we are doing work, and we have set up a regular meeting with Anthony and colleagues about how we can develop services in Bridlington. There isn't going to be, you know, a massive reopening of beds or services. And also, I would echo some of the earlier comments by Martin that healthcare has changed. A couple of people have mentioned around cardiac care. There was a coronary care unit in Bridlington until 2007 at the time of the independent reconfiguration panel review, and the assessment of the CCU at that time was that generally the outcomes were poorer than larger coronary care units. So yes, it might seem contradictory to travel, but if you have a heart attack in Bridlington, particularly if it's a certain type of heart attack, ST elevation heart attack, then the best thing for you to do is to go direct to a specialist cardiac centre at Castle Hill Hospital.
Thank you, Simon. I think we agree with that. Sorry. Can I just, excuse me, can I just say that we've got to say goodbye to Councillor Dave Tucker. I just want to acknowledge that Dave's got to go, and then we've got a few more minutes for other comments. So thank you, Dave, for coming.
Thank you very much indeed for having me again. I'm more than happy to come back once we've had our meetings, and because I am like the other council, we're all elected members, we're here to represent you. So I'm more than happy if I get an invite to come back and let you know what progress is happening. Thank you. So thank you again.
Now, we've got 5 minutes for further comments. Yeah, integration.
Going on these appointments, it's not just going there for a 20-minute scan, it's an all-day job.
Yes, exactly.
Or anywhere.
It closed at the weekend as well.
Yeah, we agree with what you're saying. We understand what you're saying. Simon needs to make a comment, and then we'll have a few more.
Gas low, but gas low's a 6-hour job.
Yeah. I'd just like to come back on some of the comments that have been made. Now, we know, Simon, that it's not just about hospitals, but hospitals are a large part for the elderly, the infirm, the people who live in Bridlington. It's got a very high population. I just wish people would own up and be honest and accept that what has happened to Bridlington Hospital is frankly scandalous. That's the first point. The second point was you made reference to the IRP, Independent Reconfiguration Panel report. Of those recommendations, only one was delivered. The other 6 that talked about investing in Bridlington Hospital weren't delivered. And my final point on scanning, for me anyway, and I've written to you and you as well, Melanie, over this, what's happening with scanners is another scandal. How is it that Scarborough's got 3, maybe one of them broken, 3, but Bridlington, with a hospital that's got space and facility, not just for Bridlington residents, but up to Filey, Hungnby and down. I think it's scandalous that we haven't got scanners in Bridlington Hospital. And that's
Andy at the back.
Just to report, 90% of the people in that room put their hand up to say that they travelled. I know we've got a delay, but I just thought...
90% of the people in the overflow room have travelled to distant hospitals for outpatients or inpatient care. This lady over here.
Staying with travel, I don't know how many years ago it was, but we had a shuttle that went from Bridlington.
Yes.
That was deemed not to be viable, it was too expensive. We talk about Bridlington having an elderly population, maybe people that can't drive, don't have the facility, don't have a car, whatever, they depend on family. They may not have family. Okay, so how does the trust expect elderly people to get from A to B? That shuttle was amazing. Where did that go to? Why was that taken?
It was cut for financial reasons, I believe, and of course the cost goes on to the poorest community within East Riding. Okay, over there.
Why did you turn down Bridlington Hospital for diagnostic unit after what you just heard?
Well, it wasn't turned down as a diagnostic unit. I think the assessment of the Integrated Care Board was that the 3 larger diagnostic centres it would invest in would be based in larger population centres.
So basically the ICB have decided that it will be in Scarborough and not in a peripheral hospital like Bridlington. We understand, we're hearing this all the time, the concern about diagnostics. We are passing it on to Simon. He's probably fed up with hearing about diagnostics because, but we've got to keep on raising the issues. I agree, we've got to keep on raising the issues.
We don't have anything like that. If you wanted to put something in place, put things for palliative care where people don't have to go, like my 92-year-old father who had to travel backwards and forwards to York, to Hull, where he died. He was a Bridlington born man, as I am, and he at 92 had to go for his chemo, and I know what he's saying, specialists are not supposed to be in Bridlington, why the hell? No. you don't know. But his care afterwards was in Castle Hill. There is plenty of beds there where he could have stayed with dignity and respect, and his family didn't have to travel a 60-mile round trip to make the end of his life comfortable. He died in a hospital with people around that he didn't know. He didn't want to be there. I could have promised him, which he asked me to do, take me home to die. I could not give him that promise. If it had been a palliative care unit at Bridlington, I could have brought him there and at least been closer. That to me...
We totally agree with your comment there. Thank you for your comment.
I think if I can just talk about palliative care for a minute, because I think when various surveys are done of patients and people around.
How quantitative are surveys? You only tick a box. What's done with that quantitative number is it's not really worth it, is it? Because you're getting...
Can I just able to respond? Is that okay? So, surveys, whatever they are a form of evidence. Sometimes they're good, sometimes they're not. But consistently, what they tend to show is when they're asked about their preferred place to end their lives, typically around 60-65% of people say, if possible, they'd like to die at home. And probably, depending, particularly if they've got experience of hospice care, 10-15% would identify hospice, and then about 20% of people in hospital. And that seems to be fairly consistent wherever we ask people. One of the things we have to then prioritise is, wherever we can, supporting people at home. And I think Anthony and Simon were in a meeting recently where we had a presentation from a community Macmillan nurse who works in Bridlington, who was explaining the level of support that can be now provided to people in their own homes. So that, for the NHS, has to be the priority about how we support people. If they choose to die at home, how they do so. It can often be very stressful, it's very demanding on their families, and therefore they often need support. But again, the community Macmillan nurses, which I think those of you who have had any experience of it would say you've actually got some really good services in Bridlington around palliative care in the community. So firstly, there is palliative care in Bridlington, and a lot of it, I'm told, is of very high quality. When my mother died, she wasn't in Bridlington, so I can't comment on it, but what I'm told is you have very good high-quality palliative care services. What we also recognise is that there are a number of people who, whether they're in Scarborough or in Castle Hill or wherever, who will be too complex to discharge into Bridlington, whether there's palliative care beds that are there or not. Some people have great medical needs in their latter stages of life and often will have to stay in hospitals. Or indeed, there are some people who, in their last days of life, my mother in Scarborough being an example, where it just would have been inappropriate to try to move them. What we do recognise is there probably are a few people in Scarborough Hospital who maybe could be and should be managed in Bridlington. And that's the work that myself and Melanie are currently doing with St Catherine's Hospice and others to look at whether we can run a pilot to open some beds in Bridlington Hospital. Now, I'm hopeful, if we can try and secure some money, that we will be able to start that at some point this year. I will update Anthony and other colleagues when we make that progress. Obviously, I'm at risk now by mentioning that this year. If it doesn't happen, I'm going to look fairly stupid, but I'm prepared to put my neck on the line and say I'd like to explore what we need about palliative care beds in Bridlington, and hopefully I'll be able to update you all later when we've got some evidence around that. But again, I think that was 7 years ago, and it way predated me. So I think for whatever reason, I think that was a decision made. Again.
I can tell you part of the reason, because I used Macmillan for my wife. They shut the Macmillan when they built the new hospital at Beverley, and they couldn't find nurses, so they took them from Macmillan. And 2 or 3 nurses says, "We're not travelling to Beverley. We're resigning. We're retiring."
Someone mentioned about evidence of the need for palliative care beds. I think it's overwhelming evidence. I mean, it's quite clear that from what we've heard today, and we've been arguing for this, and we just hope that the NHS doesn't just move at snail pace, which is usually the situation, unfortunately, and that we will indeed, Simon will be able to to bring this about, and we'll be very, very grateful for some palliative care beds here. So thank you for making that promise, Simon. That's the start of that's the start of perhaps a new era where Bridlington is actually receives more investment than it has done in the past. So I'm aware of the time. Oh, just one further comment, Diane.
It's good putting investment into people that are dying. Great. Let's put some investment into people that want to live.
Yeah, investment into people who want to live. Yeah, that's right. We
Get away with the planning going through for all the houses when they're not even looking at schools and hospitals.
yeah. Well, there are some councillors here who could perhaps enlighten us on that issue. Jane, would you like to just quickly explain?
Yeah, I actually sit on the planning committee sometimes, and as a new councillor, I've really had my eyes opened. We've got a 450 housing development coming up very shortly off the back of Darwin Road. Yeah. And I have... Sorry?
No information till about October.
Yeah, I know, I'm dealing with it. One of my problems that I've got, an understanding the system is the first problem, but when it comes to planning committee, which I've called it in, one of my problems is exactly what you guys have all been saying, is the infrastructure isn't in place. I was shocked when I heard this development was coming up, and I'm working with the residents, so I've had a meeting with them regularly, keeping them up to date. The problem is the developers are supposed to put money into a pot of money when they put an application forward. If it goes through and it is approved, then that money is something called commuted sums, and it's supposed to go into all this infrastructure. But I never know where this money goes to, and I'm trying to find out. I mean, Mike might be able to explain more than me. But Stephen Hunt, who's the head of planning, he's going to come back to me and explain this.
I think I can.
Can you?
I can add to that, because it generally doesn't go towards a health service. It goes to other things like sports and clubs and that kind of community development. Anyway, we can't get into the intricacies of
Thank you, Anthony. There is an ask of the ICB in this, though. That James is quite right. When things come to planning, there's a process normally known as outline planning, and it's at that stage that the infrastructure is examined. And there is something which is really dry. It's about 5,000 pages long, and it's called the local plan. It's administered by the East Riding of Yorkshire Council. There's been a review of it quite recently, but the evidence issue in this, I did look at section 5, page 183, paragraph 4, which is a statement which used to be by the CCG, now I'm assuming that will be ICB, to say that across the patch, be it GPs, dentistry, there may be a problem, and secondary care, nothing really to worry about. Now, I've also appeared in front of the government's inspector to appeal those phrases, but the inspector made it very clear that they will rely on the expert evidence presented by, she mentioned the CCG, but I'm sure she means the ICB. So it would be fundamentally useful if that evidence were correct. And across the East Riding, as an average, that may be correct. We're interested in Bridlington, or at least a statement that says it's not equal across the patch. That doesn't appear in the evidence document, and that's the document that the planning inspector turns up if there's a dispute. So it's a small, administrative, very dry ask. Can the evidence for the local plan be updated to reflect the inequalities across the patch, and specifically mentioning the trials and tribulations of the largest settlement? That's my ask, please.
Okay, yes, so thank you. And just to confirm my understanding of commuted sums, that is a pot of money that doesn't have to actually be put into health and dental care infrastructure. It usually goes into sports clubs and the like too, because councils haven't actually got funds to develop many facilities now, so strapped for cash as well. We really do need to finish soon. I just want to leave this up for you as you go. I'd like to thank you again for coming, particularly our special guests. Thank you for coming and being willing to face the public in Bridlington. Appreciate that. And if you wish to engage in some brief conversation after this meeting, then feel free to stay around for a few minutes. But I think we've only got the room booked until 3, theoretically, although the library is closed today. But thank you again for coming, and please make a note of our next meeting.
Thank you.